I've been asked to talk about how you can treat sciatica at home. So sciatica is a really common problem, and it's basically when your sciatic nerve, which starts in the low back, comes down deep underneath your glutes, down to the hamstring towards the back of the knee, and then it separates into two other branches. Sciatica is when this nerve gets pinched or irritated, and you can get shooting pains or pins and needles or an ache coming down either from your glutes down to the back of your leg. If it's really bad, sometimes it can start from the low back and shoot all the way down to your foot and to your heel, and it's really uncomfortable and can be really painful. There are several different causes for sciatica. So one of the most common ones is having a slight disc bulge or a disc herniation, which means that the disc in your lower spine protrudes out slightly and pinches the top of the sciatic nerve, and then you get these radiations. The other really common reason for sciatic type symptoms is if you've got a really tight piriformis muscle. So your piriformis muscle starts from your sacrum and goes across to your hip bone out here. So we're definitely going to do some exercises to loosen that muscle off. We're going to do some foam rolling exercises for the low back and hamstrings. And I'm also going to talk about a couple of other useful things you can do if you're suffering with sciatica, but at the moment obviously you can't get out to see a physio or osteopath. So the first thing we want to do for sciatica is move. So if you're in a really acute stage, so it's really painful, then some of the exercises we're going to go on to are probably going to be too much. So if it's really sore, you're just going to twist and move, probably standing up in the pain-free zone, just to get those joints and those muscles in the low back moving a little bit. The worst thing you can do for sciatica is just sit. If you're sitting down all day or lying in bed all day, it's not going to get any better and it'll probably get worse. So even if it's slightly uncomfortable or painful, try and move. The first thing we're going to do is basically loosen off the muscles and some of the joints in our low back. So for that we're going to use the Manta foam roller. So most foam rollers you shouldn't use on your low back because they hit the spinous processes rather than targeting the muscles either side. And when those muscles get tight, they can compress the joints and discs in the spine, making it more likely that discs are squeezing out and also reducing the movement and the space that the sciatic nerve can move through. So making sure your back is as mobile and as loose as possible is really, really important. So what we're going to do, first exercise, we're going to have our hands on the central prongs, feel our spine, the base of our spine into the groove, so you can literally use your fingers and make sure your spine's right in the groove. To begin with, we're going to support some of our weight with our hands, slowly lift our pelvis just a centimetre off the floor, and we're just going to rock through here for sort of 30 to 90 seconds. What this is doing is really getting into those muscles either side of the lumbar spine. Now sciatica is usually one-sided, so most of the time when you get sciatica it'll be one side more than the other. If that's the case, then you'll probably find that one side of your muscles next to your spine are tighter or more tender than the other side. So if that is the case, start off just rolling normally, but if, say, I've got the sciatica coming down my left leg and it's the left low back muscles that are really tender, I'm going to shift my weight and tilt gently and slowly into these muscles to get more weight and more pressure coming into those tight muscles. Now in this position, either just hold it, so you've just got your weight coming down, pressure of that central prong getting into that foam roller and helping that muscle gradually relax, or oscillate a little bit just to break down any myofascial adhesions and to loosen things up. And of course I'd go to the other side as well just to balance this out. So that's a really nice one to start with. If your sciatica isn't too severe and you're able to do that without too much discomfort, then of course you can cross your arms over and work a little bit higher and a little bit longer strokes through the muscle. But as we've said before, you have to keep your chest high. So if you don't have the core strength to sit up, use your hands, because what you don't want to do is extend back. If you extend, especially if you're suffering with sciatica, you're pinching the joints where the nerve exits the spine, and it's just going to pinch that nerve and be very sore and uncomfortable, as well as likely cause those muscles to tighten up. So remember to keep your chest high when you're doing this is a really important one. So that's a really nice one. I think obviously all the sort of lumbar mobilisations that we did yesterday in the lunchtime low back mobility class, so all the tilts from side to side, gentle knee hugs. If you want to start one knee at a time, that's absolutely fine. But the foam roller is really good for getting into those tight muscles and just helping loosen off that low back, take a little bit of pressure if we can off the lower discs and open up the sort of holes where the nerve exits through the lower spine. So that's exercise number 1, and of course any extra stretches you want to do alongside, standing, sort of ballerina type stretches, all of those things are great. We're now going to follow the path of the nerve down into our glutes. So as we said, the piriformis comes from our sacrum and goes down to the outside of our hip bone, and it turns our leg out basically. It's one of its actions anyway. Now, most foam rollers, especially if you've got a smooth one, tend to hit the bone without getting deep into the muscle. So the piriformis is sitting deep to the glute max, and often foam rollers will just hit the bone and miss the actual piriformis itself. Luckily, the central prongs are perfect for getting in between and missing the bony nodules and really gets into the piriformis. If you don't have a Manta foam roller, then try a golf ball or a squash ball or a massage ball, but it needs to be fairly small because you want to miss the bone and really get into the muscle. If it's too big, then you might find that it just hits the superior glute max and some of the bony nodules. So for loosening off your piriformis, we're going to pretend for the duration of this that my sciatica is coming down my left leg. So it's going to be the left piriformis that I want to loosen off. What we're going to do is we're going to sit with the left cheek of your buttock right over the central prongs of the Manta roller. You're going to have straighten one leg a little bit with a leg that you're going to be massaging the glute. Cross this over. What this does is actually stretches the piriformis a little bit and allows you to really get into that muscle. So what we're going to do now, all we're doing here is rolling from the sort of top of our pelvis down towards our upper hamstring. And again, you want to do all these movements quite slow and controlled. Slower is always better than fast with most things you're doing on a foam roller. The other thing you want to do is just shift your weight a little bit, change the direction, so you're getting ever so slightly different parts of the muscle. Again, if you find a real sore spot, it might be a trigger point, then you can just release that off either by just holding it or just slowly oscillating over that area for 30 to 90 seconds. And that's a really nice one. If you want to make it even harder, so we're going to put a bigger stretch on the piriformis, which means when we're rolling over it, you're getting a more powerful cross-fibre release to break down the myofascial adhesions and to help the muscle spindles relax a little bit. We're going to come across, pull our knee towards our chest, and carry on rolling, but adding in an extra stretch. Now, if you're in acute pain or a lot of pain, this will probably be a step too far, so just start gently. And while we don't mind it being a little bit sore and a bit achy, if it causes too much sharp pain, then ease off straight away. There's no point irritating the nerve or any of the muscles. So that's a really nice one. The other stretch that I find really useful for people suffering with sciatica and piriformis issues is when you're lying on your back. I'll try and do it at an angle so you can see what I'm doing. So this is a good one because A, you can do it in bed, which is really nice, and it's also one of the most powerful stretches you can get for your piriformis. So you're going to bend your knee to 90 degrees, hold on to the top of your knee, turn your ankle in, hold on to your shin, and then you're going to squeeze in and across. So you're getting a really strong stretch through these glutes and the deep piriformis muscle. And we're going to hold it here 5 to 10 seconds, and I usually repeat it 3 or 4 times. And the other nice thing with this is you can play around with different angles to get different portions of the muscles. So that's a really good one, and again, you can do that in bed or on the floor, add it into your mobility workout, and also do it both sides.